That familiar gnawing feeling, the burning sensation, or just a general discomfort in your stomach area can be truly unsettling, especially if you have a history of stomach ulcers. It is natural to wonder if these returning symptoms might mean a past problem is making an unwelcome comeback. Yes, indigestion, medically known as dyspepsia, can indeed be a sign that a stomach ulcer is recurring. While indigestion is a very common symptom with many possible causes, its reappearance, particularly alongside other specific signs, should prompt you to pay close attention and seek medical advice. The reason indigestion can signal a recurring ulcer lies in the nature of the condition itself. An ulcer is essentially an open sore on the lining of your stomach or the upper part of your small intestine. When this lining becomes irritated or inflamed again, often due to factors like the Helicobacter pylori bacteria or the continued use of non-steroidal anti-inflammatory drugs, it can lead to the classic symptoms of indigestion. This irritation triggers pain and discomfort, often described as a burning or aching sensation, especially when your stomach is empty or at night. It is important to remember that while indigestion is a key symptom, many other less serious conditions can also cause it, so it is never a definitive diagnosis on its own. If you are experiencing recurring indigestion, especially if you have a history of ulcers, the most important step is to talk to your doctor. They will need to review your medical history, discuss your symptoms in detail, and potentially perform tests to determine the exact cause. This might include a breath test or stool test to check for H. pylori, or an endoscopy, which involves looking directly at your stomach lining with a small camera. Avoiding self-diagnosis and getting a professional evaluation is crucial for proper treatment. A key insight is understanding the difference between general indigestion and ulcer-related symptoms. While functional dyspepsia, which is indigestion without an obvious underlying cause, is common, ulcer pain often has specific characteristics, such as pain that is relieved by eating or taking antacids, but returns hours later. It is also important to watch for alarm symptoms like unexplained weight loss, difficulty swallowing, vomiting blood or black, tarry stools, as these requiring immediate medical attention. By understanding the potential link between indigestion and ulcer recurrence, you empower yourself to be proactive about your health. Monitoring your symptoms and discussing any concerns with your healthcare provider can lead to early diagnosis and effective management, helping you to maintain your stomach health and enjoy a greater sense of well-being.